Hi everyone! I know the lower limb can be tough and complicated, but I will break it down into the simplest steps to help you out. So, let's get started! In this lesson, we're gonna discuss the clinicals of the lower limb. Now let's talk about the transverse patellar fracture. This type of the fracture happens when the patella breaks into the two halves. The proximal half is pulled upward by the quadriceps tendon, while the distal half is pulled downward by the patellar tendon. Next, let's move on to the patellar tendinitis. This is also known as the jumper's knee. This condition involves the pain and the swelling at the proximal end of the patellar tendon, and it is caused by the overuse and stress on the knee. Let's discuss boot-off fracture. This occurs when the tibia breaks above the top of the boot, often due to the high-speed forward fall after skiing. Let's talk about the transverse march stressed fracture, and this fracture occurs above the boot-off fracture line and are commonly seen in the people who do a lot of hiking. Moving on to the tibial plateau fracture. This is also known as the bumper syndrome. This injury occurs at the top of the tibia near the knee joint. They often result from the sudden trauma, such as in the car accident or the high-impact sport, and can cause significant damage to the knee. Let's cover the port surtipedron fractures. This type of the fracture involves the lateral fibula, the medial and the posterior malleolus of the tibia, and often include a tear of the deltoid ligament. This results from the severe ankle injuries, such as those caused by the high-impact trauma. Let's discuss foot drop, which occurs due to damage to the common peroneal nerve. This nerve controls the muscles in the front and side of the lower leg, so injury to it can cause difficulty in dorsiflexion and inversion. Let's talk about the plantar fasciitis. This condition involves inflammation of the tissue on the bottom of the foot, causing pain, especially after prolonged rest. It's most commonly felt in the morning when you first get up. Let's discuss coxa valga and the coxa vara. In coxa valga, the angle between the head and the shaft of the femur is increased, ranging from 135 to the 140. But in contrast, coxa vara is when this angle decreases, usually between 135 degrees to the 120 degrees. Let's talk about the unhappy triad. This is also known as Donahue triad. This injury involves the tearing of the tibial collateral ligament, anterior cruciate ligament, and the medial meniscus, and it's commonly seen in the football players due to the sudden twist or impacts to the knee. Let's discuss Baker's cyst. This is also known as popliteal cyst. This condition occurs when the cyst forms at the back of the knee joint due to the protrusion of the synovial fluid, often resulting from the knee inflammation or injury. Next, let's look at a bucket handle tear of the knee. This type of the injury involves a vertical tear of the meniscus that creates a shape resembling a bucket handle. It usually happens when the knee is forcefully twisted and flexed. Let's move on to the ankle sprain. This condition occurs when the ligaments of the ankle are excessively stretched or torn. There are two types of the ankle sprain, a lateral ligament sprain and the medial ligament sprain. In a lateral ligament sprain, which affect the ligaments on the outside of the ankle, including the anterior talofibular ligament, posterior talofibular ligament, and calcaneofibular ligament. On the other hand, a medial ligament sprain impacts the ligaments on the inside of the ankle, such as the anterior tibiotalar ligament, posterior tibiotalar ligament, and tibio-navicular ligament and tibiocalcaneal ligament. Next, let's discuss Weaver's bottom, which is inflammation of the bursa located over the ischial tuberosity, the bony part of the pelvis that you sit on. This condition can cause pain and discomfort in the buttocks, especially when you're sitting for a long period of time. Let's talk about hallux valgus and hallux varus. In hallux valgus, the big toe deviates laterally, causing swelling on the inside of the foot. In contrast, hallux varus involves the big toe deviation medially, leading to swelling on the outside of the foot. Next, let's look at the toe deformities. In mallet toe, the distal phalanx bends down, and the hammer toe occurs when the middle joint of the toe bends down. And then claw toe involves both the middle joint and the tip of the toe being flexed. Let's talk about popliteal aneurysm. This condition involves the dilation of the popliteal artery, which is located behind the knee. The treatment often involves ligations of the femoral artery to prevent complications and manage blood flow. Next, let's cover the plantar reflex, a positive Babinski sign where the toe curls upward instead of curling down, can indicate an injury or issue with the brain or spinal cord. Let's talk about genu valgum and the genu varum. Genu valgum is also known as knock knee, which involves the abnormal growth of the lateral compartments of the bone and the medial collateral ligament tear. As a result of this, lateral compartment collapse. And in contrast, genu varum is also known as the bow legs, which involves the abnormal growth of the medial compartment of the bones and the lateral collateral ligament tear. As a result, the medial compartment collapse. Let's discuss prepatellar bursitis. This is also known as housemaid's knee. The condition involves inflammation and pain in the prepatellar bursa, which is located in front of the kneecap, often due to the prolonged kneeling or repetitive pressure on the knee. Now let's talk about infrapatellar bursitis. This is also known as clergyman's knee. This condition involves inflammation and pain in the infrapatellar bursa, which is located just below the kneecap, often caused by the repetitive kneeling and pressure on the knee. Next, let's cover pes cavus and the pes planus. Pes cavus is also known as the claw foot, which occur when the medial longitudinal arch of the foot is abnormally high. On the other hand, the pes planus is also known as the flat foot, which involves when the medial longitudinal arch is lost, causing the foot to be flattened. Now let's talk about the hip fractures, which can be classified into the two types, the intracapsular fractures and the extracapsular fractures. The intracapsular fracture can further classify into the subfractures, subcapital fractures and the transcervical fracture. Subcapital fractures occur at the neck of the femur and the transcervical fracture occur closer to the trochanteric line. On the other hand, extracapsular fracture can further classify into the three types, subtrochanteric fractures, which occur below 5 cm from the trochanters, and the intertrochanteric fractures which occur at the trochanters, and the pretrochanteric fracture which extend throughout the trochanters. I hope you enjoy this video and don't forget to like, subscribe and comment below. Stay tuned for the more content and thanks for watching.